Continuation of our segment 1 return demonstration head to toe assessment, we are going now to assess the patient's nose and mouth. So first, we are going to inspect and palpate the external part of the patient's nose. Then we are going to instruct the patient to occlude one nostrils as she inhale and exhale. If the patient reported unimpaired sense of smell during the health history, we are now going to test the olfactory nerve by having her identify specific smells with her eyes closed as he occlude one nostrils at a time pass a aromatic substance like vanilla or coffee under the unoccluded nostrils. Now we are going to inspect the nasal cavity using the otoscope with a short, wide tip speculum. To widen the nostrils, apply gentle pressure to the tip of the patient's nose with our thumb. Then, tilt her head back slightly and insert the speculum slightly into each nostrils. Avoid contact of the sensitive nasal septum. And then hold the otoscope handle to one side to avoid the patient's chin and to improve our mobility. So as if this is our speculum, since I don't have here available. Then we are going to direct the speculum toward the back of the nostril, then move it upward in small increments to view the nasal cavity. After we inspect the nasal cavity, we are now going to inspect the nasal septum. Then, finally, the nasal turbinates. After assessing the patient's nose, now we are going to assess her mouth. To start the mouth assessment, we are going to instruct the patient to bite down, bare her teeth, and while we are assessing the jaw alignment. Okay, ma'am. Smile. Okay. Now we are going to inspect the patient's lip and we are going to instruct her to close his mouth. Ma'am, please close your mouth. Okay. If we see any suspicious lesions, we are going to palpate the patient's lip and it should be soft and smooth. Then, we must document any abnormal findings. The next thing that we are going to do is to assess the oral mucosa of the patient, wherein we are going to use a light source and a tongue blade, as if this is a tongue blade. Okay, and open your mouth for me, please. Next, we are going to assess the patient's teeth and gums. Okay, can you open your mouth? After assessing the patient's teeth and gums, we are now going to assess the patient's oral cavity. The hard palate should appear bony and whitish. The soft palate should look muscular and pinkish. The uvula should be pink, midline, and free of lesions. Then we inspect the tongue. Using a gauge pad, hold the patient's tongue. We are going to hold the patient's tongue to one side and palpate the floor of the mouth. Then we are going to tell the patient to stick out his tongue. It should be in the midline and free from tremors. Okay, can you open your tongue for me, please? Okay, i-push mo dapat. Open yung tongue. Open mo. Kabila na po. Okay. Yak. Yak. Yawa ko manut bras nanay. Then we are going to place the tongue blade on the side of the patient's mouth. Then instruct her to push it away as if this is a tongue blade. Okay, open your mouth now. Then we are going to check the glossopharyngeal and the vagus nerve by depressing the tongue and instructing the patient to say ah. Okay, can you open your mouth for me, please? Then instruct the patient again to say ah and inspect the pharynx and the tonsils. Then we are going to grade the tonsils on a scale from +1 to +4 if they touches each other. Can you open your mouth for me, please? If the patient reported an impaired sense of taste during the health history, we are going to assess her facial and glossopharyngeal nerve by having her identify different flavors. Then we are going to lightly touch the back of his tongue with the tongue blade where she should gog. Can you open your mouth for me, please?